2nd of January we went with our own money, bought the laptop, and it's a completely different feel. And I said, I sponsored laptops, that kind of thing. So that's how we started. And thankfully, within a month, we had a term sheet for $1 million. So we have now clocked 100,000 women screen with this. That was end of February. So we are very glad because, as you said, it's a test, first time in India, first time in the world, and to get the acceptance of all the hospitals, partners, to actually do this test means it's not like they are my friends and they are agreeing.
Correct.
They are really agreeing because this technology works. 2 billion women need to be screened every year. 200 million are getting screened today. Only 10% of women are being addressed.
Yeah.
So there's 90% of women who don't have any test to do but have HIV.
Thanks, Geetha, for joining us today for this interview. You have, innovated one of the most effective solutions for women in healthcare, that is breast cancer solution. And I personally would be so skeptical of going for an examination given how difficult the process is. But now that I read about you and your technology on the website, I'm like, okay, I'm more comfortable to do this, and it's much better. It's non-invasive, plus it doesn't include any touch. So tell me, how did you even start with this technology? Because it's so difficult to, go against the traditional path and develop a solution like this. So tell me, how did the journey begin?
So I'm basically a computer scientist. I call myself an accidental entrepreneur because I did my PhD. Then I was very happy being a principal scientist at Hewlett-Packard Labs for 17 years. And then I went on to lead artificial intelligence research lab for Xerox. And so I was a lab director at there and working with many young researchers, trying to sort of connect the dots, to the business, come up with business plan and so on, like an entrepreneur, I would say. And it was all good, and suddenly one day I came to know that a very close cousin sister of mine, Bharti, got detected with breast cancer. It was 4th stage, and she had a few more months to go. That was a day I still remember. I was on a pillion rider of my brother, and he told me, and I went blank. A very close friend, every summer I used to spend with her, and suddenly she's not going to be there in 3 months. It was extremely shocking. Of course, I spent time with her and all of that, and we tried to sort of go to the right doctor, but she couldn't live more than 6 months. That left a very, very big, like a painful thing in my mind. And I said, we are doing research I was working with US researchers, European researchers, the Xerox Park, and all of these were my colleagues, and we were doing wonderful problem solving. But here I'm seeing so many women die of breast cancer. As luck or unluck would have, within 6 months, another close family member on my husband's side got detected with breast cancer.
At 4th stage?
She had seen something, but mammography didn't pick up. She was 38 years old.
God.
And she died on her son's birthday.
Oh shit.
That was crazy to me. And I just made up my mind, I need to do something about this. That's when I started reading up about breast cancer, discussing with my friends about it, and finally figured out that there is probably another way of doing things. And I said, okay, let me experiment it. So started a small research experiment in my lab. I had exploratory budget. Thankfully, my superiors were very happy with what we were doing, so they said, okay, go ahead.
In your lab, as in which lab?
In Xerox itself, my previous organization. And so that's when it happened. And after about 6 months or so, I said, okay, I want to spend the rest of my life in this. So I said, I want to quit and make this a real thing on the ground, because you can't run too much inside a corporate setting. Right? So it's a lot of hurdles and all of that. And then It took me 6 months to come out.
Before you did it by yourself, you were conducting the research in your firm where you worked as an
Yeah,
employee.
just as you know, my own passionate thing, because I could start newer things, and it's about imaging.
Okay.
And I was also in AI lab director. It was
Yeah.
related to AI. Just started that initial few experiments, but then I realized that this is what I want to do. So I quit. I put up a
Okay.
proposal to quit. Of course, it took
Yeah,
me
yeah.
6 months to come out. So on
And what were you doing in those 6 months?
doing my normal lab director law
Not
job.
researching on the
This
breast
was my
cancer.
weekend activity, midnight
Oh.
activity, right?
Okay, okay.
And I had like 26 or 29 projects to handle
Yeah.
as a lab director. So that was my main day job, and this
Right.
was my night thing. Then that's what I decided to switch.
Okay.
Flip.
So when was it when you decided to switch? Was it when you
2016.
found the solution?
Not really. We had not found, like, we didn't have the full solution or anything. Angle of working in thermal imaging. That's
Okay.
that is all I knew at that
Yeah,
time.
yeah.
But we had to make it real, prove the accuracy. There's a lot more things to do.
Yeah.
But I said I'm going to work on the thermal imaging and see.
Okay.
So I called two of my team members, Shiva and Himanshu, are still there. I said, I feel like starting launching a new startup here. Would you join? And they said, okay, if you are starting, we'll come, because it's going to be interesting.
Yeah.
And I told them, okay, give me 3 months. If I don't raise funds within 3 months, I will get you a job. Okay.
3 months is a very short
Very
time.
short time, and because I had some time running to make sure that with my previous organization, some agreements had to be closed, and I had only 90 days time for that.
Yeah.
So all this pushed me to multiple things. But long story short, I decided to quit. It took 6 months for me to come out.
Yeah.
And 1st Jan 2017, we were all on the kind of ground, literally grounded,
Okay.
trying to see how we can change the way breast cancer is detected.
So 3 of you all started it? The
So
two colleagues and you?
2 of my team members and another team member, Nidhi Mathur,
Okay.
program manager in
Yeah.
my team. She also joined in as actually co-founder.
Okay.
And then,
so was
yeah,
she
we had-
working with Xerox earlier?
Yeah, she was in my, all the 3 of them were in my lab.
Okay.
Yeah.
So they decided that we'll also
they will
move
come
with
with
you.
me. Yeah, so
Okay.
that's what happened. And of course, Nidhi is not with us anymore. So she stopped after 1.5, 2 years
Yeah.
actually. But Shiva and Himanshu are still with me. But of course, as founders, it's me, single founder right now. Yeah.
Okay. And the other co-founder you mentioned about?
No, they are founding team members. The young
Understood.
engineers.
Oh, so
things
you're
like that.
a solo
Yeah.
woman founder.
Yeah, that's true.
Were you questioned by any investors that how will you run this? Because that is one bias that still is there.
Right. Yeah, definitely. There were some doubts, especially when when 2 founders became single founder. I guess a lot of doubt. Yeah, sure.
Yeah. But tell me,
I
how
think-
did that happen? She joined as the co-founder and then became a part
Yeah,
of
I
the
mean,
founding
people
team
get
member.
tired of running. I can't do
Correct.
anything much
I
about
mean,
it.
everybody can't hustle with you Bangalore, Bombay one day.
Yeah, I mean, it requires a lot of stamina to run, especially a healthcare startup. So
Correct.
everybody has their own preferences.
Okay.
And
So
preferred way
what
of
were some
running.
of the questions that you were asked by the investors for being a solo woman founder?
No, nobody questions me like, are you solo woman founder
Huh.
and so on, right on my face. But I guess, when you get started, right, it takes time to build trust with the
Yeah.
investors that you can do it. And it took me almost, I guess, 6 months to actually gain back their trust fully, because it's founder exit is not easy.
Yeah.
For anybody.
Correct,
And
correct.
but it was good. I'm so thankful to our investors for having the trust in me.
You were saying that from Jan 1st, 2017, you were literally on the ground. So tell me, where did you start working from? What was your office like? Was it a garage, as every startup founder has?
Yeah, actually we said, okay, it may be my house garage, but fortunately for us, just before quitting, I love competing, right, to check the merit,
Yeah.
like with reviewers and so on. So we competed in one of the startup contests, and we won the contest called Tata Incubate, I think it was called. Tata Alexi was,
Okay.
running this Incubate program.
Yeah.
and we won it. And they asked me, what do you want? I said, give us 5-member car space because we're going to come out and I don't know where to go, and haven't raised funds, so I need place for 5 people to sit. They said, oh, by all means, and we had a wonderful space there. I asked for 3 months, they gave me for 6 months.
Wow. Did they just give you space or something apart from that?
Yeah, they were trying to sort of connect with people and so on.
Okay, but they didn't put any money.
No, I mean different incubators have different functions, right? So we were already talking to the investors, and that was not the highest priority for me at that time from this particular organization, and that is where we started. I still remember on Airport Road, all of us used to go, and very interesting. That 2nd of January we went with our own money, bought the laptop, and it's a completely different feel. And I said, I sponsored laptops, that kind of thing. So that's how we started. And thankfully, within a month, we had a term sheet for $1 million. So
wow.
Yeah. So
tell me about how did that happen?
So one of my basically classmates from my masters connected me to Pi Ventures, which is led by Manish Singhal and at that time Umakant as well. It's an AI fund, and so I went and pitched on 2nd January 2017, I remember. And they asked a lot of grilling questions, and at the end Manish said, yeah, there is I think there's something in it. I would like
there's a spark, as they call it.
Yeah, I would like to sort of continue the discussion. Felt good because that was our first pitch, literally.
Right.
And after that, we told like we're running on fast track, and we have 90 days time. We need to sort of get the money in the bank. And he said, okay, we'll work with your timeline, and that was nice. And I was so glad that within 1 month, 3rd February 2017. I had the term sheet in my hand.
Wow.
I'm very thankful to Manish, particularly on this.
Yeah.
And I take every opportunity to thank him for that, because it was not just term sheet, right? It was a grilling due diligence for 1 month. Grilling to the extent that, we keep remembering that he said, I can't believe this is actually going to work. So show me the code. He did, and he did a code review. To make sure we have not done some, golmaal out there. I mean, it's okay. Like, I like it for that, right? Because you test it and before, So that's how it was, and then of course we had a bunch of other co-investors come in.
In the same round?
Same round, Ankur Capital, Impact Fund, wonderful discussion with Ritu.
Yeah.
And they
came in the first 3 months?
Yeah.
Okay.
Yeah, very fast, right?
Yeah.
And then also Axeler, that is Chris Gopalakrishnan Sir, Venugopal, Ganapati. So that was also very, very quick and nicely closed.
Yeah.
We had Binny Bansal come in as well.
Yeah, tell me about how you got Binny Bansal. Did any investor introduce him to you?
Yeah. Actually, I think it was Manish only introduced me to Shailesh, who handles Binny, and then I thought it would be good to have Binny's, name on it as well. So it will just give us a little bit more glamour on it, honestly. And then. Of course, he took us. We met him in his office, and he was very happy with the problem that we are solving, because it's going to help so many women.
Correct.
And so he agreed to come in, and that really helped us get some media bites.
Correct.
In addition to, of course, the wonderful investors we already had.
Yeah.
So that was an experience of a kind for me, because that was the first time I was raising funds.
Yeah.
Trying to make business plan. They ask you a question, I'll come back in 2 days, go or do all the homework and go back, and it's not that you have everything worked out when you do the first pitch.
Like which questions were you asked?
What's the market size like, and what's the, what exactly is the problem solving, what is the PMF and all of that, right? You're just thinking about the idea, and how do you sort of convert that idea into answering these investor questions. Now it seems like, of course I should have done this, but when you start, you don't know about all of this, right? So that.
But you pitched them the product basis which they invested, or was it just at the idea stage?
Almost idea stage.
Okay.
But I would say little bit proof of concept, because at that time I had screened 78 women. with breast cancer and said, okay, there is a possibility of
Oh.
finding cancer, but all of them were cancer patients. So we had to
Okay.
look at non-cancer patients and make sure and so on. But there is something about
Yeah.
it. Not automatically saying, but taking images and saying, oh yeah, there is something here.
Oh.
So we can
So
actually
like you
detect it.
sampled about 80 women and most of them were prone to the disease?
No, we purposely, okay. What I did was, we were already collaborating with the hospital, with a doctor. So I asked the doctor, can we actually, in fact, along with another Dr. L.K. Mesta, we asked, can we image two patients, you know, because we don't know whether this will work or not.
Yeah.
This was when I was in the previous company.
Two
itself.
patients who already had it.
So they basically said, I can give you patients who already have it, right? And
just
they're
to
going
see.
for surgery tomorrow.
Huh.
So they wouldn't mind imaging because this is harmless.
Correct.
So that's how it started.
Yeah.
And after seeing these two images, and I thought definitely we can write a computer, because I've led so many software projects, AI projects, and I think this is doable.
Huh.
Then we said, okay, so we can't take more images like that informally, right? So, so then we set up a formal proposal with the hospital to get next 100 patients, but 75 is when we thought, okay, it's looking okay, sufficient. So 75, 78 patients, we took the images of people who were going for surgery next day. They already knew they had cancer. But the idea is, first and foremost, Radhika, we make sure that if we are developing something to detect, let's say, cancer, first, can we detect cancer? That's the first question for a pivotal study, right? So once that is done, then you say, can I screen everybody to find these people? That is, there are not false positives.
Correct.
But when you know somebody has cancer and if you are not able to detect, there's no point in continuing. So that's the sort of the like like a litmus test, if you will. So that's what we want to do first. And
Got it,
that's
got
when I said, okay, this is something we need to do. But then the idea is like, what is the use of screening people who already know they have cancer?
Right.
So then I said, why not do it in screening? So I looked up who else is doing thermal imaging or anything. I found only one doctor, Dr. Ram Prakash sir.
Okay.
So I wrote to him, I called him actually and said, can I meet you? And yeah, you can come on a Saturday. He thought I was coming there for screening. I said, okay, why not? So we went there and told him this is what it is and so on. So for 8 years he had done 300 patients. Very, very small number. So because he was the only thermal imaging person there and he was doing it more from his own passion, own liking, but not really sort of, in a large scale.
It?
No. So thermal imaging has been around for some time. That idea of using thermal scanner for breast screening is not ours. It's been around. And that's what I understood, like, reading the literature and so on. But the problem is it is never been used as a conclusive or useful pre-screening method of detecting cancer. Because when you take a thermal image, you have so many color points and there's no doctor who can confidently look at that color image and say yes or no. Because it's a very, very complex task. We are looking at 4 lakh temperature points in all color and then trying to do a guesswork.
Okay.
And also there's only a little bit that you can actually show in color. For example, if you're looking at what is called a heat map of temperature, 34 degrees, 35 degrees Celsius, both of them will be red. Whereas if you actually take a temperature map of it, 34 degrees Celsius and 34.02 degrees Celsius could be 2 different points and you can work on it. So that's the idea I wanted to catch on to. I said, why look at the color image? Why not look at the temperature value itself? And that's what we do in our test today. Look at temperature values directly and analyze it so that we can detect very, very small cancers more and more accurately. So anyway, that is the part which we have built in the AI based analysis, artificial intelligence based analysis on temperature variation.
Okay, so that was the only doctor in India who was doing
who was doing just thermal image actually, right? And he was
like,
looking
why
at,
wasn't it being done by others?
because it's not
very
regularly
accurate?
standard. It's not a standard thing because people in pockets have tried it and done it along with the rest of the imagings and so on and so forth. But there's so much of power in thermal scanning. It is not radiation based, non-radiation based. That means we're not throwing X-ray or like nothing. We're just measuring the temperature that's coming out of our body. Our body is an infrared source, and we are trying to sort of measure what our body is throwing at the environment.
So when you have the cancer, is the heat temperature different?
It will be at a slightly higher temperature than rest of the tissue. We're talking about the tissue level, cell level thingy,
Okay.
right? And also the blood flow to the cancer area is much higher.
Okay.
And so we have novel algorithms to extract blood vessel structure from a thermal scan, thermal image, and also identify how many may be there, how many, like, you know, what we call as additional blood vessels may come in, neovascularization, we say. So all of that we are able to now, with a patented algorithm, detect those things.
Okay.
So all that will help us.
And how long did it take for you to develop a solution like this? Like you said, you left your organization near to 2016, right? The end
2017 January is when we started. So we started 2017 January. We had a little bit, not very accurate, maybe 80% accurate solution at that time.
Yeah.
And after about it took about 7 months to actually build a product around it with whatever accuracy we had. And we went to a hospital, BMS hospital. I met the board chairman and requested that we put this in there.
Yeah.
We went through the lot of reviews, and then we had a doctor who was willing to interpret and understand our report, and in parallelly interpret the image as well, so that we can do the right thing for the end user. So our reports used to go to Dr. Ramprakash sir, who knew how to do thermal imaging. Obviously, he has done it before, and also refer to our report and change it if it's not right, literally. So that's how we started. And because the doctor was reviewing it and he's already an expert, they allowed us to start. And after that, it's been a long journey. Karnataka Cancer Society, which is a outreach camps, right? They do a lot of camps in rural areas.
Okay.
So there they were using hand examination because that's the standard in India.
Yeah.
So India, it's a big problem. Breast cancer is the top cancer.
Right.
Every alternate lady detected with breast cancer is dying.
Yeah.
And the only way to save them is early detection. So this is where, a technique like this, which can detect much before a lump is felt, will be useful to the women. So
but how did you develop a technology like this which didn't even exist? What was the changing code that you used in it which made it much better? So and is this technology there in the US otherwise?
No, we are the only company in the world which does AI on thermal distribution to find cancer.
Yeah.
There are a few pockets of research labs who have tried to sort of develop the AI part, but they have published and left it there, right? And gone to the next problem, and also worked on very small data sets and so on and so forth, but not really tested on biopsy or compared with another test or any of those things. And also there's none who has regulatory clearance from both Europe and US, for sure. And I'm very glad to mention, Radhika, that we have now clocked 100,000 women screened with this. That was the end of February. So we are very glad because, as you said, it's a test first time in India, first time in the world, and to get the acceptance of all the hospitals, partners, to actually do this test means it's not like they are my friends and they are agreeing.
Correct.
They are really because agreeing because this technology works, right? And they ask a lot of questions, test it out on their patients, only then give it to their users. So that we have done in hundreds of such locations.
Wow.
And today, we actually also inaugurated the mobile medical unit with this.
Okay.
And I think with
what
this,
does that do?
So basically, it's a small van, the Tempo Traveler, we call it, small ambulance you will see, which has 2 rooms. Like the back side, we've removed all the seats and made into 2 kind of rooms, compartments. One compartment is for screening, another compartment is for the technologist or a technician. So basically, the beauty of our test is that it's completely privacy aware. The lady enters into one room, she closes the door or screen and then removes her clothes. Nobody sees her without clothes, right? Whereas in all other tests, there's the technician coming and women handling or man handling and all of that, right? To basically do the imaging and so on. So here there is no touch, no see, no pain, no radiation.
Yeah,
These are the
correct.
4 no's we talk about.
Yeah.
So in this room, inside the patient is there and outside the technician.
Huh.
Takes about 10 minutes, we blow cool air and then 2
Okay.
minutes of imaging, and
Yeah.
we give instant reporting.
Okay.
So within 15 minutes she will know her health and she
Oh.
can go and get the next person.
How did you make it so faster? Was it always 15 minutes, or you have improved the technology?
You know, we've been in this for now 6 years, right?
Yeah.
You know, we've definitely improvised on the accuracy, improvised on the process. Because first few camps I used to go, you know, along with the Cancer Society to do the camps, because you need to sort of see it firsthand.
Correct.
Right, and so many, like even things like putting a curtain between the two of us,
Yeah.
like the technician and this was an idea, because I was trying to screen one of my friends.
Huh.
I mean, I didn't want to see her without clothes, and she
Correct.
didn't want me to see her.
Huh.
So I said, why don't we put a
Yeah.
like a curtain between our laptop and the camera
Yeah.
and put a wire here.
Okay.
I just tried, and it was such a cool
Yeah.
thing to have a no-see
Right.
solution. So we made it USP right now.
Simple, but only
Simple.
necessity gives you that idea that you can also do that.
Exactly, yeah.
Wow.
So many such small things.
Huh.
Like we used to give the test, and we want the villagers or health workers from the village only do the test, so that, you know, it's scalable,
Right.
Low skilled workers, you know, and also it's an employment opportunity for girls
Correct.
who just graduated or got a diploma, and
Yeah.
they're in the village, right? So when we were giving this, you know, it is fine, but they used to call left as right and right as left. You know, they were getting completely
Correct,
confused,
correct.
right?
Yeah.
And they were making mistakes, and later we figured out mistake, and they trained them. Then we came up with an algorithm to detect which is the angle,
Oh.
and automatically it will, you know, change
Okay.
all the things, and
Yeah.
and if she's taken wrongly, it will immediately tell you have not taken it properly, redo it.
Right.
So many of these innovations
Came
that we
through
have
customers.
done, like customers, field experience, and so on, right? So it's been a wonderful journey, I would say.
Yes, I know. I
Just-
can imagine how lovely it has been for you. But
Yeah.
tell me, which were the most challenging times where you had to convince the hospitals to tie up with you, or maybe you know, organize camps outside your own city in rural areas? Tell me about the time when you had to really convince them that this is a good thing and you should do it.
Honestly, convincing women in rural areas
Yeah.
to take this test was easier
Okay.
than compared to convincing the doctors.
Really?
Yeah, definitely.
Okay.
I mean, for a reason, because obviously, you know, clinicians and doctors basically want to make sure that, you know, because they're in a tough position where they're going to give a guideline or guidance to the lady, and cancer is not a simple disease.
Yeah.
Especially the news of a person is likely to have cancer is worst news any girl or lady can
Correct.
hear in her life, right? So we have to be very careful about you know, any test that does and so on. So rightfully so, doctors initially were very skeptical about this test. So for example, initially you know, when we went in and said this is this and there's an AI, you know, based test that can work on it, I have never read it in my books. Nobody ever is doing this. You
Yeah.
know, why should it work? How does it work? And so on. So basically we told, like, you know, it is about AI, because I personally have solved hundreds of AI problems in my lab in my previous career. So I guess we have used all the good stuff from there, learnings from there into this in some sense, right? So we were trying to sort of explain how the AI works and how is it different from, let's say, other deep learning methods that are out there,
Yeah.
which are so easy to kind of, you know, copy and replicate and so on. So, but it's not about, we realize it's not about explaining how it works. It's about showing that it works, which
Right.
means that we said, okay, please give us a test. Every person who is taking your standard of care, mammography, ultrasound, biopsy,
Yeah.
put all of it in one place and then let them go through our test, and we'll give
Yeah.
you the answer, you compare.
Yeah.
So it was a hard, you know, challenge that I had to take, but I thought, like, without this, nobody's going to accept.
How did they say yes then?
if this was easy, because it was just measuring temperature, okay, you can go and do it on my patients. Of course, you have to take user consent. Anyway, they're going to do it. Before that, you take 15 minutes, do it.
Okay.
As long as the user agrees, of course.
Yeah,
so we have all this consent. And there are standard processes called ethics committee approval, and like there is processes in healthcare for that. We went through that process, and then we went through this comparative study. And of course, the first study we missed a few cases. In symptomatic people, that is,
as in
we did not detect in the first study, which was basically symptomatic. Already, like, you know, they knew there is something out there, kind of thing. Then we fine-tuned, saying, okay, there is. Then the next study, it was all small evaluations. The next systematic study, we were able to fine-tune the algorithm in a way that we did not miss any cancer in screening population.
But when you missed it, was it like a red alert for the hospitals?
No, it's not really that. You know, nobody expects 100% accuracy.
Okay.
Nobody
so
expects.
Okay with it.
Yeah. You know, it's not that they're using it to guide the end user initially. Initially,
it was
it's
just
about
for your testing.
It's for testing. Like, you know, they were not using this at that time, right? But once you fine tune, it became like when we showed that it is actually close to 100%, actually 100% in screening population. Then, you know, it's not just showing it. We'll have to submit it to top journals who are peer reviewed, and you know, it's a long process of multiple reviews. They do ask a lot of questions, and then we got into a very good journal called American Society of Clinical Oncology Journal. That gave us some standing. After that, people started saying, okay, there is something in it. So let's experiment on my team first, on my patients first, and then I will adopt. That was also fine. And then now it's more like we've done many such studies. We've got very good results, much better than standard of care, in fact, and published in 30 plus journals, articles. So now it's like, show me the list of journals, and we point them to our list, and then say, okay, you have Lancet Oncology, you have SABCS, you have ASCO, okay, fine. Show it to me on this one camp you do for me, and then I will.
But tell me one thing, that how do you even get somebody to go and do this test? As you said, it detects at early stages, but how will you initiate that somebody goes and actually takes that test to detect it at early stages? Because some people just wait for the last minute, and until they see the symptoms, it's already third or the fourth stage.
So it's really about awareness, right? You know, if you look at US, every person above 40-45 years goes for an annual checkup, or biannual, depending on the age. Same with UK, they get a letter as soon as they turn 50 or something like that, you know, at home, and these are all covered by the government, and other insurance and other payers, they would have connections. But in India, hand examination is standard. So even in rural areas, these screenings are happening, where people go and say, do you have a lump, do you have a lump, and then they make a note, and ASHA workers do that. But that is not sufficient, because, you know, people may not know how to check for lumps. People only will feel the lump after 2.5 centimeters, which is stage 2 and above. So how do we kind of, you know, make regular screening possible? So early detection is only possible where every person proactively, in a preventative manner, goes for regular health checkup, at least once a year, otherwise at least once in 2 years, to check for things. So that is where this test will be used.
And you said it works for all age groups, right?
Yes. Unfortunately, we have detected a 17-year-old with cancer with this.
Oh my God.
It's crazy. But generally, we recommend 25 and above, so that, you know, unless they have a family cancer history.
So did she have it, the 17-year-old?
Yes. She had come to a hospital already with a little bit of a lump already. So that's why we scanned, otherwise we wouldn't have
Correct. Okay. That's scary, actually.
It's scary, No, actually 27% of all cancers are under 45 years. And especially in India, the mean age for breast cancer is 10 years younger than the rest of the world. So yes, we have more younger women getting cancer in India. Breast cancer. Unfortunate.
I'm so happy you've developed this solution. But I mean, on the awareness side of things, you said that people need to become more aware of your technology so that they can use it and not get scared of the traditional one and not go there. So how are your marketing efforts? I know that you have home screening tests also, and then one is with hospitals and then the other is with camp. So tell me how these three verticals work, and is there any other way also where you're making people aware about it?
So firstly, it's not really about don't go to the existing test and come here, because 2 billion women need to be screened every year.
Okay.
200 million are getting screened today. Only 10% of the women are being addressed.
Yeah.
So there's 90% of women who don't have any test to do but hand examination. We are just going after them. We are like, let women go to any test that works for them. That's the power of awareness creation, right? When we do our webinars, we just say these are the tests, you can take any of these tests, but these are the plus, this is the minus.
Correct.
And you choose, like if you have dense breast, please, there's no point in going for mammography because it's not going to work. Everybody knows in the field, right? But there's no awareness, right? No, so any person under 45 would have a dense breast, so she cannot anyway use mammography. Please come here.
Okay.
About 50% women above 45 have dense breast. So
sorry, what is dense breast? I don't know.
Dense breast is just a type of tissue where when you take an X-ray, the whole breast appears white.
Okay.
It's like X-ray always shows dense stuff white, right? You take a X-ray of my hand, a skeleton appears white because it's harder. Bones appear white, right? So, so if somebody has dense breast, which is more tissue, more fibril glands and so on, then the whole breast appears white, and you're trying to find a white spot on it, which is not possible.
Correct.
So it's a limitation of mammography for that, and like many radiologists know, but not end users like us. Even I didn't know, right, when I started. But when I learned about this, I said, so the target segment is maybe people who can't even go for a mammogram for multiple reasons. One, under 45, or they have dense breast and above 45. It's more than 50-60% of women above 45 also. And then how many people can afford to give 3,000, 4,000 rupees per year to do this test? So affordability is also an issue.
So how much is our solution for?
It's less than half of it.
Okay.
And when we go to villages, we have a triad solution which is literally $2.
Okay.
So we do like a lot of different products we have. So we make sure that everyone can actually access. Usually we sponsor it for rural. We get sponsors for it.
Grants.
So daily camp sponsorship is doable for you and me type.
Correct.
Right. So and then we don't charge the end user like in rural areas or urban poor. Right. That is free for them. But somebody else is sort of donating for the day like that. So those kind of things.
Got it.
We do. So so basically we don't address the exact target market. If mammography is possible, that's fine. Otherwise, you please come here.
But mammography can't detect at early stage, or can it?
It can detect early stage. It is the only one which is proven to improve the mortality rates. Reduce the mortality rates.
But the chances are higher with our solution.
No, basically mammography, as I said, does not work on younger women.
Okay.
And it does not work on half of the elderly women, right? And second thing is it is radiation based, so you cannot do it once a year for many years. You can do it once a year or once in 2 years. Thirdly, the experience of doing a mammogram is something that people may want to avoid because somebody pulls the breast, puts between the two plates, and 10 kgs of weight is applied and so on.
Is it 10 kgs?
Yeah, literally, like a pressure.
Oh my God.
Then and then of course affordability, accessibility. A machine itself is 80 lakh rupees, and how many hospitals will give it? So it also affects the access. So many of these factors are the reason why in India hand examination is the standard for general population screening. So our aim is to actually make every lady on earth do this test once a year, for example, after 25. And if we do that, I think we'll be able to literally detect cancer at stage 0, stage 1. And we have wonderful techniques for treatment. We have oncologists who are innovating on every day, and I'm sure we'll be able to. Treatment efficacy is known to be more than 90% if it's detected in stage 0, stage 1. That's where we're going. We can definitely save
I hope
many lives.
at least 1 billion women take these tests out of 2 billion. Right now it's just 200 million, like you said. So hoping for that to happen. But what did you start with initially? I'm sure home screening came later on.
Right. So we started off with mostly outreach to start with Karnataka Cancer Society, doing camps, and when hand examination was used, we did hand examination and this. So we really don't want to do any harm to the lady, right?
Correct.
So if somebody was found to be positive in this, we were bringing her to a hospital for further tests and seeing whether it's kind of okay or not. And then next we went on to the hospital because we actually showed that we were making a difference here.
Yeah.
And also, as I mentioned, we did clinical studies showing
Huh.
the efficacy, and that's how commercially we started in
Okay.
hospitals as well. And during COVID, that's another big blow.
Yeah. You all had launched something for COVID also,
Right.
right?
During
What was
COVID,
it?
what happened was people were not coming to hospital for non-COVID reasons.
Yeah.
Even the government said, don't go to hospitals if you don't have COVID, and everybody stopped screening.
Okay.
Everybody stopped all kinds of screening except COVID. And so I remember April 2020, we had 2 screenings in the whole month. It was like in thousands to 2. It was extremely shocking. And of course, we were also seeing lots of pain around, and not that we wanted to change it or anything, change the screening and all of that. Then also there were guidelines not to get more people in one room, social distancing.
Correct.
We all remember that. And because of that, camps we could not do. So it was pretty tough, and then that is when we started home screening.
Huh.
Because we were also getting calls from women saying, I feel there is some lump, there's something I'm not able to do mammogram. So we launched it to people who actually wanted to go for a test, but they couldn't come out of the house.
Yeah.
And there's no way you can take a mammogram to a home. So we said, why not do this? Because we've already proven the
Correct.
efficacy. And so we launched this home screening. Within the first 3 months, we found 3 major abnormalities which led to detection of cancer as well. And so we realized that it's actually helpful to women as well. So we launched it. Now it's available in 20 cities.
Yeah.
We partner with on the ground providers also. Not that everywhere we don't need to provide.
Yeah.
And so that's still going on.
Huh.
Though we are not in the services industry, we are more a product company.
Correct.
But this is another
Vertical,
line
yeah.
or thing that's happening.
And the mobile van, what was the need that triggered you to create a piece like
Yeah, our test is actually very portable. You can put everything into a backpack and do the test either inside a hospital or take it out and do the test
Okay.
outside. So far, like we did the home screening in a backpack, we were also doing like rural screening, doing it in primary schools and primary healthcare centers and so on in villages and all. But what happens every time you go there, you have to set it up, figure out which room to do
Yeah.
it and all of that. So, but if you have it in a van, now you can take this van, park it anywhere, call people around,
Yeah.
do the screening inside the van and send them, and then keep doing it like in
Okay.
mobile way.
Got it.
So that's how we kind of started doing it. While a van is not always necessary to do this because the equipment itself is portable, as
Yeah.
opposed to other screening vans,
Huh.
right, where you put the machine and so big that you can't take it inside a home. Ours is portable, but because it kind of makes it easy for people to come in and do it, I think it makes a huge. For example, you can go into slums now
Yeah.
without worrying about what kind of infrastructure there exists, and all of them
Right,
can be
right,
done.
right.
So this is mainly meant for screening.
Okay. Have you ever thought of making it do it yourself kind of screening, like COVID results were being used in that way?
That's my dream actually.
है ना?
So we do have it working on a mobile phone.
Okay.
Where you can download a app
Yeah.
and do the screening.
Huh.
But we are not releasing it because we have to make sure that end users will not get anxious, and the kind of messaging we do is all we have to do some psychology kind of research in order to, before we actually release it as a selfie. I call it selfie screening. And but right now we're giving the same simple devices to gynecologists so that they can experiment first. Experiment in the sense that they will try it out on their patients.
Yeah.
Figure out what's the best way to use usability experimentation. I'm saying accuracy and all is very good.
Okay. So you've already developed it.
You have already developed, yes. We have developed
it's in the testing phase.
It's in the testing from a usability angle.
Yeah.
What needs to change, what kind of message we have to give,
Wow.
what kind of stand to use, and these kind of things.
Huh.
Right. So we are working on it. And
this is, what I call is real innovation. Who would have thought that you can actually do it on your phone and at your home?
Yeah, hopefully. Of course, the price point also has to be brought down. So we are doing some research in all those directions.
Yeah.
But instead of self-test examination, which is recommended every month, doing self-test examination with a device rather than a hand. So I always think about this. Many of us do have diabetic sugar test machine, the one touch and all of that. And it's so common nowadays, you know, and but maybe our fathers and grandfathers used to go to a hospital to do that sugar test, you know. So now nobody does that, you know, you have it at home, you put the prick and then put it. So that's how simple even breast screening should be.
Correct.
Then you will actually detect it earliest symptom. Every month you can do it.
And you don't even need that much awareness, because you can just do it at home.
Do it at your home, and
phone.
if there's something looking abnormal, go and show it to your doctor. So hopefully we will be doing this in the next maybe couple of years only. It will be in every hand.
And when you got this idea, what was investors' reaction? What questions did they ask you?
You know, I mean, you know, investors are more risk averse than us.
Correct.
We are more optimistic as founders. But I mean, I think we need to have a balance. It's always a debate, right? You know, like for example, don't get distracted, focus on hospitals and so on. But of course, we will do the hospital. There's this XYZ who is doing it. This is like PQR, somebody else doing this. You know, we always have that debate. It's not about defocusing. It's really about exploring all options early and fail early.
Which one works the best.
Right? And we don't want to do these and leave some part for a competition to pick up and do the most easiest expansion that we can do. So
I think that was the most convincing point. They'll be like, shit, competition aa gaya, so what will we do?
It's really about, does it really work? Will you reduce the value? I think these are all good questions. But, you know, think about it, you know, we have so many, like Sony has so many versions of TV. It's not like, you know, you cannot sell I mean, there are different target segments for each. Like, you know, there are some people who can buy the whatever the internet TV thingy, and the other one who still buys a simple, like, you know, there are different segments, and when you have a vision of making a difference to everyone's lives, right? It's like universal cancer screening. Then you need, one size doesn't fit everybody, right? You need different customers. So that's sort of the thought process. It slowly convince some as we move along, as we show the business value. We are seeing it. Yeah,
but in terms of your investment rounds, I just have a quick rapid fire for this segment particularly, where I want to ask you, how did you get each one of your investor, just by not disclosing much details, for our founders' perspective as to if they look for fundraising, how should they approach?
You will name the person or name the investor? No, right?
No, it's up to you. I mean, if you're not okay, it's fine. So I'll start with the most famous one, which is Dream Incubator, a Japanese VC firm investing in your company. How did that happen?
Dream Incubator, I got connected through one of our previous round investors, that's 500 startups. Shalini connected me with Eto-san. We went in, we presented. He liked our work because he comes from Japan, where 78% of women above 45 have dense breasts. So that's one thing. And the conversation went on a couple of rounds, and he liked what we were doing. It's very relevant to Japan, and we also felt it will add value. In addition to money, we have a gateway into Japan, which is a very, very important country where this technology will help, and so that's how it happened.
And how many months until you got the term sheet from them?
From Dream Incubator, it may be 2 months or so.
Wow, I mean, I've not seen any startup get term sheets so fast.
But there are like multiple
due diligences.
Multiple due diligence and multiple investors you go to first, and then we landed in the right one. I think, when you actually meet the right investor, maybe things move much faster. You know, when somebody is taking months and years, then you say, okay, are they really interested, or are they just wasting your time? You know, I started getting that feel for some of the investors who don't say no, but they say, okay, one more question, and
as a founder, you really need to choose your investors very wisely.
I think it's a marriage, right? They have to choose the founders wisely, and we need to find, because there has to be thematic mapping and many other mappings have to be done. But again, I'm very thankful that we have a bunch of investors. All of them are aligned with the vision of making a difference on the ground.
Correct.
Like, investing, I guess, with both heart and head. Right? That sort of is what is needed for social entrepreneurship.
Since you mentioned about 500 startups, how did you get in touch with them?
Good question. So I got in touch with 500 startups through Binny.
Okay.
And his Binny's counterpart Shailesh actually. So they both generally have invested in many places. So when we reached out to Binny, they said even 500 startups interested. So we thought it's good because it will give us a US flavor, and
Correct.
if required we can
expand there.
get them there as well.
Yeah, and I also saw you have Google's accelerator program on board. So did you apply to it because they have a big process to follow?
Yeah, so they were running this at that time. They didn't have Google for India. They had only international competition. So I remember I almost missed the deadline, and Paul said, okay, fine, I'll extend the deadline by one day, go put it. So we put it, and then I'm so glad we made it.
They extended the deadline for you?
Just they allowed us to do it. And then of course it was an excellent program, I would say. It was an excellent program in San Francisco.
Okay, so were you housed there for some time?
We spent I think 1 or 2 weeks in the beginning. Then it was virtual, and then again 1 or 2 weeks in the end.
Okay.
So the good part was when we actually met in person, it was like full rigorous workshops since morning till night.
Okay. Workshops about what?
In the sense, multiple very, very famous people will come and talk to you and explain their story.
Yeah.
For example, of course, we met the ex-CTO of Google. Many of the CTO, Chief Technology Officers came in because it was more about cloud, and I know they wanted to focus more on the technology front, right? So many of those came in. I met, and they were like, we were all, I mean, at least I was a fan of many of those. It was amazing. And then also we had roundtable with CEOs who have accomplished in the Bay Area. Come in and sort of we do a roundtable and tell our problem, and they will tell this is how I would have solved. Very, very interesting piece.
Nice.
At that time, in fact, this selfie idea was still in my mind, and I had bounced it off, and everybody said that's the most scalable version of it. And that gave me the investor support as well. Going back, and many such things actually. It was very good, and also we were 33 founders around
the globe.
That were in the
and
class.
we were talking to all of them at the same time under the same roof.
Right, we were also talking among ourselves, like 5 of the CEOs come together, solve each other's problem. Very much, active and very nice, very nice.
Yeah,
really like that.
Sounds like a very helpful ecosystem.
Very helpful, very helpful.
So, what did you take home from there apart from this validation of this selfie testing?
I think main thing I took home is confidence.
Okay.
Confidence that we are on the right path.
Yes.
Confidence that what we are inventing and what we have developed is not just for India.
Yeah.
It's like suddenly the world becomes your target segment.
Yeah.
And of course, we got a lot of attention, like a graduation stamp, right? Being on a class 5. So multiple things.
A stamp like Howard stamp, where the world comes together.
Yes, absolutely. So multiple things, of course, beyond the tangible stuff.
And what were the questions that they asked you in the application process, just for the benefit of our audience?
So these are actually usual questions like, who is your target segment, and what's your business plan, and what's your go-to market, and what is the problem statement. I think one thing that if a founder has to get it right is the problem statement. It looks so simple. Why? Of course I know the problem. It's not always true, right? I want to solve the reduce the deaths due to breast cancer. It's a very big problem. Break it down, saying what is the problem you're solving in that, right? The problem of dense breasts and the fact that the current methods do not have it. So understanding the current methodologies, current competition and current workflows that is being used in a particular, be it healthcare or any other, and then saying how is this different and how is this going to fit into it. How are you going to reach the customers who are going to use this, the go-to-market part. We really have to spend time thinking about it. You feel but it's really going to the nitty-gritties and saying, and then finally, who's going to pay for it? Fine, women are benefiting, but for example, in US, women may not pay. We need to get the reimbursement done, right? So how do you get into the reimbursement?
Why wouldn't they pay?
Generally, many of these countries are not end-user paid healthcare. We are so used to paying for our tests. It's not like that there, right? There's like insurance who pays, it's pretty much everybody is insured, right? Because healthcare is very expensive. So that means you have to have a story, stakeholder is your insurance.
Okay.
So that way, the different.
So have you scaled to the US market as of now?
We've just started with 3 doctors who are using it right now, but we don't yet have insurance reimbursement.
It's through the hospitals that you're doing it?
Private doctors right now.
Okay, that's nice. And how did Be Next come on your cap table?
Be Next, usually many of these investors are in the network of your current investors or previous round investors. So Be Next was connected to me by Axeler VG.
Okay.
He connected me to Terusan, and after that it has been a good journey.
Yeah. I think it's just the push that you require initially, and then the current investors bring the next round of
it's really a warm connect that helps.
Yeah.
You can't simply, maybe luck, but usually if you just take hold a name of a investor and write, they will have tons of such emails.
Yeah.
It's very difficult for them to pay attention. A warm connect means like somebody can recommend, but that person has to really know you and your technology and be able to recommend literally, not just connect. They actually recommend, then it gets more attention. And of course, after that, it's about grilling, multi due diligence, and that's
I'm actually very interested in the grilling part. Let me just ask you a question. Which one was the toughest due diligence that you had faced, and why was it difficult?
So I think, of course, Pi Ventures was grilling, but he didn't make it tough because he made it very natural, and we were answering.
Yeah.
But I think the grilling one, I know Ritu will be angry. It's the Uncle Capital.
They are
like really grilling. I think so far that's been a major grilling. I remember, I used to go in the car and even in Ola, at the back, right? And she used to say, "Can I have 10 minutes?" Okay, sure. Put it out, side me. It used to go for 1.5 hours.
Okay.
Asking questions. And then night, we used to have calls with the US counterparts and Kamakshi. Hi. So she.
Who is Kamakshi?
Is Ankur Capital person who is in US, and she's a scientist and PhD and all that. Oh my God, she used to. I liked it, of course. Right. Because any of these happens, you feel like okay, they're doing it because they want to believe in you, right? And more you answer these, pass these due diligence, it just increases their trust in you, and it's very, very important. Because they understand the business that you are in, understand the solution you're bringing in, and they can give us ideas. They can think with us as needed, right? Or when you propose something, they're able to relate to it. All of these, and I definitely, we have.
So what were the questions you were asked by Kamakshi or maybe Ankur which made it difficult?
No, it's not difficult. It's just very detailed. Same thing, it doesn't exist anywhere. How it works, and tell me more. What is the physics of this?
Okay.
And so you have to go back and read how IR cameras work, and go back and answer her. She says, "Okay, I found this article. Go read it and figure out why and how you can." All of that. Yeah. So a lot of homework associated with it as well. Yeah.
It's lots of hustle. I mean, it's not an easy job for everyone.
Yeah, it's good actually when you're passionate about doing it, and it's like your baby, right? And you try to sort of.
And how does the revenue model work? Of course, you charge on the testings, but
it's a SaaS-based revenue model. Every testing is a pay-per-use model.
Yeah.
And because it's a cloud-hosted test, there's a hardware component which is off-the-shelf thermal camera. We can provide you that as well as a distributor.
You sell the hardware also.
Hardware also, along with the software for India.
Okay.
We give them at a better price because we just give the distributor price. And then software is per scan basis. For internationally, we ask them to buy the hardware and we give per scan basis. It's a SaaS model. So it's much easier to expand to different countries.
Right. So which one is working better? The B2B part of distribution?
Everything is B2B2C only. Everything is B2B2C except the home screening part, which is more like a service type of thing.
It's more of D2C rather than B2C.
So we always do B2B2C.
Yeah.
And so we sell it to the doctor or service provider, and they sell it to the end user.
Okay.
So it will go with a SaaS model.
Yeah, and which geographical area in India has given you more revenues and more demand for this?
So I think we are there in almost all states now, and because we are based in Bangalore, we have more number of installations in Bangalore.
Okay.
and definitely revenue from Bangalore is much higher.
Yeah.
We have a bunch of installations in Maharashtra as well.
Huh.
And now last year we started screening in Punjab. The government has started screening in
Okay.
Punjab. It's a government funded program. And we are also in Andhra Pradesh and Telangana. We're going to start shortly. We are there in some hospitals, but government Telangana is going to start. Orissa we are going to start. We have started.
All through
Calcutta.
government?
Government is in Maharashtra, Karnataka, Andhra Pradesh, Telangana, and Punjab so far.
Do we have any service in Bombay? I'm very keen.
Yes, you can go to Health Spring and
Okay.
and
Is that a hospital?
it's a diagnostic chain.
Okay.
Any of those, and also HCG.
Yeah.
And some of these places.
Yeah. Until I turn 25, I hope your selfie screening test comes into the market and I'm able to use that.
Sure. And you can also get the test done in your own office.
Yeah.
You can just say, okay, today is Women's Day. Let me have like half a day of screening. So any of the corporates, so many corporates are doing in March.
Yeah.
Actually, yeah.
That's nice.
Yeah.
Good to know. So what's your team size now?
So we are about 65 people, core members, and then about 40 plus technicians, right? So we are, of course, century.
Yeah.
we clocked it, and we're very happy. A very, very passionate team.
Huh.
And
When did you buy your first office? First one?
rental?
Yeah.
Renting the first office was after our first round of funding.
After Pi Ventures.
After Pi Venture funding, yeah.
Okay.
So we rented a small place in Koramangala.
Oh,
And
that's
now, of
nice.
course, we moved to the next one after we got the second round of funding.
Oh, of course. The
Of
team
course.
member size increased.
Size also increased, and
Yeah. Oh, that's good to know. And how's the culture in your firm? How do you
it's
act as
a
a leader?
family. Literally, it's a family.
Huh.
Everybody relates to the company from their heart, right?
Yeah.
And we have a lot of fun as well. So Holi celebration, Christmas celebration, Dasara, Puja, we do everything.
Holi tha abhi to
Holi
आपने-
bhi ho gaya. And of course, we are still hybrid working.
Huh.
So
Okay. What are the timings otherwise officially?
I think it's, it's supposed to be 5 days, but it's a startup and anytime middle of the night also.
Yeah.
Not really middle of the night,
Huh.
weekends. We can get calls, but
Yeah.
not really. But yeah.
But good, on that good note, we come to the end of the interview, and I thank you so much for being on our show and talking about such an important issue. I'm sure that this will create lots of awareness, and thanks for your time to be able to speak on your journey and the issue.
Thank you so much, Radhika. It's been a pleasure speaking with you as well. Thank you.
Thanks.